Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Friday, September 5th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today, we are joined via video conference by Sarah Karlin-Smith of the Pink Sheet.
Hi, everybody.
Alice Miranda Ollstein of Politico.
Hello.
And Jessie Hellmann of CQ Roll Call.
Hi there.
Later in this episode, we'll have my interview with my KFF Health News colleague Tony Leys, who reported and wrote the August Bill of the Month about a patient's unfortunate run-in with a bat and an even more unfortunate run-in with the bill for rabies prophylaxis. But first, this week's news. Well, it is safe to say that there has been quite a bit of health news since we last met in mid-August. Health and Human Services Secretary Robert F. Kennedy Jr. testified before the Senate Finance Committee yesterday, which we will talk about in a moment. But first, I want to catch us up on what you might have missed. Our story starts with the FDA's approval of this year's COVID boosters, which are only being licensed for those over age 65 and those who are younger but have at least one condition that puts them at high risk of serious illness if they contract the virus. That leaves out lots of people that many doctors think ought to be boosted, like pregnant women and children. Sarah, what's supposed to happen after the FDA acts? The next step happens at CDC, right?
Correct. So right now, the CDC's Advisory Committee on Immunization Practices is scheduled to meet September 17th, 18th, 18th, 19th, but about 2 weeks from now. And they would typically vote on sort of endorsing use of these vaccines and, again, have sort of a second chance to weigh in on which populations they would be used for. And that's often important for triggering insurance coverage without copays. And also many states rely on the CDC recommendations for various state laws that say, again, who can get the vaccine or whether you can get it via a pharmacist or only at a doctor's office. Do you need a prescription and things like that? So the CDC and FDA, I would say in general, is a little bit behind this year. I could think a lot of people have been trying to go out and get these new shots, even though those steps haven't happened yet.
That's right. I mean, it is early. Even if there was nothing else going on, there is that little bit of a lag between when the FDA acts and when the CDC acts, right?
Yeah, there usually is. I think in the past they've tried to have both FDA approval and the CDC act so that the vaccines could start rolling out more like late summer, early September. So they're definitely behind. And there's been a number of reports of COVID kind of slowly rising as the summer winds down and school gets back in session.
Yeah, so there's a lot of other things going on. Well, in the meantime, nothing that was supposed to happen has happened yet, and we still don't know all the details, but it certainly appears that Susan Manaras, who was just confirmed by the Senate to lead the CDC a month ago, was fired after she refused to override her scientific advisors and approve the new restrictions on COVID vaccine availability even before the ACIP met. In turn, 4 top CDC leaders resigned as well, going public to warn that the agency is being politicized by the secretary. How much of a mess is the CDC in right now, and how long is it going to take to put the pieces back together?
I think they're in a pretty bad place because not only did they lose their director really quickly, but after she resigned, I think it was 8 or 9 senior CDC leaders resigned last week as well. And so really critical people to various parts of the operation that you don't just replace very easily. And Kennedy has slotted in Jim O'Neill as the temporary director of the CDC and kind of indicated he wants to remake the agency. And I think there are questions as to how that remaking shapes both its priorities and how it handles public health throughout the U.S.
And of course, morale at CDC is awesome, in part because, as we discussed the last time we met, a gunman came and shot up the place, killing a policeman and leaving the staff pretty upset. And that gunman who then took his own life was later found to have had some discontent with vaccines. So things are just really bright and cheery there in Atlanta at the CDC. Alice, I see you nodding.
These things kind of snowball, I think there are likely to be a lot of staff who were already on the fence about staying and decided to stay because they trusted these pretty senior leaders with a lot of, decades of expertise and institutional knowledge. And that was sort of the thread they were hanging on as well. At least I'm with these people. And now that they've left, I think, that could trigger a bigger exodus on top of the exodus that was already underway.
And it's important to say, even though we say it, I think, every time, that these are career scientists who've worked for Democrats and Republicans over the years. These are not generally political people. They're not political appointees, and they basically, do their jobs. And, until fairly recently, public health wasn't this partisan. So it wasn't that hard to be a career public health official just working for public health. That's just not the case anymore, is it?
I think there's been a lot of insult to injury added with what happened with the shooting at the CDC, because there is a sense that the kind of rhetoric that Kennedy in particular has used over the years, even before he came into HHS, on sort of his movement has sort of amplified the criticism of public health workers and put them in this situation where they're dangerous. And Kennedy, instead of really acknowledging that and maybe apologizing or giving any sense that he was going to shift in a different direction, has actually really kind of doubled down on it. And even in the sort of some of the pieces he's written recently about how he wants to reform the CDC, he kind of keeps criticizing the rank and file employees and so forth. So there's a lot of tension between the political leadership and the career staff, I think, at this moment.
And in normal times, most of the American public would not even know the names of these people. They're not public figures. They're just very behind the scenes, scientists doing their work. And now their personal photos are being combed through and shared, to attack them because they've criticized the administration. They're getting threats. It's just this whole level, like you said, of politicization that we haven't seen before.
Well, so in kind of a coincidence, Kennedy had already agreed to appear on Thursday before the Senate Finance Committee, which, by the way, doesn't have jurisdiction over the CDC or the rest of the Public Health Service. But no matter, a Senate hearing is a Senate hearing. And let's just say it didn't go that well for the secretary. Democrats were kind of withering in their criticism of Kennedy's 8-month tenure so far. Here's Colorado Senator Michael Bennet.
This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology.
Republicans weren't that impressed either, particularly the Republicans on the committee who are also doctors. Bill Cassidy, a doctor who's on finance, but is also the chairman of the Health, Education, Labor, and Pensions Committee and is facing a primary challenge in Louisiana, seemed to tread pretty carefully. More surprising, at least to me, was Dr. Senator John Barrasso of Wyoming, who's also in the Senate leadership.
So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work.
I was super impressed that even the Republicans who criticized RFK were careful not to criticize President Trump. In fact, there were several suggestions, this was clearly a talking point, that Trump should be given a Nobel Prize for his work overseeing Operation Warp Speed, just so the senators could kind of bifurcate their complaints. What impact, if any, is this hearing going to have on RFK's future as secretary?
Well, I think there was an attempt to, I think what you just mentioned, that dual criticism with praise of Trump, was meant to drive a wedge and to get Trump to question RFK's leadership. That does not seem to have worked so far. We don't know what's going to happen in the future, but I think it's an attempt to get the message to Trump that RFK's reputation and actions could be damaging to, the administration overall. And there was some reporting that polling showing that most people do support vaccines was circulated amongst Republican members before the hearing. So I think it's trying to, get the message that this is both damaging in a public health sense, but also potentially damaging in a political sense as well. But so far, the reporting is that Trump is was, standing by RFK, that he liked how combative he was. And so I don't know where those attempts to drive a wedge will go in the future. But like you said, it was notable that if folks like Barrasso, Tillis, who's not running for re-election, was also, more vocally critical, and, a couple others. Not a lot. We're not seeing like a great dam breaking yet, but I think there's more cracks than there used to be on the GOP side.
I did notice that Trump had a very strange Truth Social post earlier in the week that basically said that, CDC is a mess and it has to be fixed. Kind of just Trump being the omniscient observer. And then apparently at a dinner with tech titans after the hearing, he said that he had not watched the hearing, but that he heard that Kennedy did well, which is not exactly what I would call a ringing endorsement. I feel like Trump is giving himself some runway to go either way, depending on sort of how things continue to shake out.
Yeah,
I see nodding.
Yeah, I saw a lot of people reposting that clip on social media last night who are frustrated with Kennedy and using it to try and ramp up their base and say, keep calling, keep pressuring. This shows we have an opening. I mean, I think it's really always hard to read the tea leaves with Trump and his language and words. He's a harder person to interpret. But I also thought it was really interesting that in some ways, Cassidy and some of the other Republicans were throwing RFK a bone and saying, this is your president. This was his greatest achievement. Can you support it? And RFK couldn't even really twist himself into doing that. He sort of tried to, but he could never square it with the bulk of his remarks at the hearing, which were incredibly critical. mRNA vaccines and vaccines in general. He defended the massive cuts in this area for research. He defended people who have really said very untrue things about the harm caused by these vaccines. So, in some ways, I felt like Cassidy was trying to give him one more chance or something, and RFK couldn't even take it when it was couched as this, Trump achievement.
I can't help but wonder if this is playing to Trump's advantage because it's distracting from Trump's other problems, that perhaps Trump likes that there's so much attention on this because it takes attention away from other things.
Yeah, although I do find the eagerness of Democratic members of Congress and other folks to wave away certain things as a distraction as a little bit questionable. This is all part of the agenda of the administration, and, dismantling government bureaucracy is clearly a core part of the administration's agenda.
And flooding the zone.
Exactly. Well, it might also serve as a distraction. I think that it should be considered, a serious part of what they actually want to do as well.
So there were a couple of things that we learned about RFK Jr. from his confirmation hearings back in the winter. One is that he's not at all deferential to elected officials, even calling them liars, which is pretty unheard of, and that he doesn't really know how his department works. And it appears that 8 months later, neither of those things have changed. How does he get away with being so rude? I mean, I've just never seen a cabinet official who's been so undeferential to the people who basically put him in office. Is it just me?
I think it's part of the times where politics is really trumping behavior or policy, right? Even though there were a few Republicans that we've talked about who have kind of started to get frustrated with RFK and his vaccine policies. You saw at the beginning of the hearing, Chairman Crapo was asked by the ranking Democrat, Senator Wyden, to basically swear Kennedy in because Wyden has felt like Kennedy has lied to the committee before. And, Crapo just basically brushed that away and dismissed it. And I think so in many ways, a lot of the Republicans on the committee endorsed Kennedy's behavior, kind of maybe not overtly, but indirectly. And that's sort of been how they've been operating. It's more of a political theater thing. And they're okay with sort of this disrespect if it's sort of a political fight that's going, that somebody on their side is taking up.
I also think Congress's unwillingness so far to actually, sanction or take action in any way about anything RFK has done seems to have emboldened him. I think the fact that he has broken all these promises he made to Cassidy and other senators, and there have been basically no consequences for him so far, feeds into that. I mean, he kind of has a "what are you going to do" attitude. That was very evident in the hearing.
Yeah, I think that's fair. Well, there were, as always, parochial questions from senators about home state issues. But one topic I don't think I expected to see come up as many times as it did was the future of the abortion pill, mifepristone, which is about to celebrate the 25th anniversary of its original approval by the FDA. Alice, what are you hearing about whether FDA is going to rein the drug back in, which is what a lot of these anti-abortion Republicans really want to see happen?
Yeah, so I think there was nothing new in the hearing this week. What he said was what he's been saying, that they're looking into it, that they're evaluating. He made no specific commitments. He made gave no specific timelines. He said basically enough to keep the anti-abortion people thinking that they're cooking up some restrictions, but not explicitly promising that either. And so I think we're just where we were before. They continue to reference data put forward by an anti-abortion think tank that was not peer-reviewed and claiming that it is, this solid scientific evidence, which it is not, about the risks posed by the pills, which many actual credible peer-reviewed studies have found to be very safe. And so we just don't know what's going to happen. I think any nationwide restrictions, which is what they're mulling at the federal level, which would impact, states where abortion is legally protected, that would be a potentially politically damaging move. And so it's understandable why they might not want to pull that trigger right now.
And Trump has said, right. Trump has indicated that he does not really want to wade into this.
Correct. But again, he's also very good about not making hard promises in either direction and sort of keeping his options open, which is what they're doing. The anti-abortion activists, this is not their only iron in the fire. This is just one of many strategies they have going on. They also have multiple pending lawsuits and court cases that are attempting to accomplish the same thing. They're pursuing new policies at the state level, which we'll probably talk about, Texas and others. And so, yes, this pressure on FDA and HHS to use regulation to restrict the pills is only one of many ongoing efforts.
Well, you have anticipated my next question, which is that while we are on the subject of the abortion pill, Texas, because it is always Texas, has a new bill on its way to the governor for a signature to try to outlaw telemedicine prescribing of the abortion pill. What exactly would this Texas law do, and would it work? Because obviously this has been the biggest loophole about, stopping abortion in these states that have banned abortion, is that people are still able to get these pills from other states via telemedicine.
Yeah, so in one sense, nothing's changed. Abortion was already illegal in Texas, whether you use a pill or have a procedure. And so this is just layered on top of that. The groups who backed this, explicitly said the attempt is to have a chilling effect. What they're hoping is that no lawsuits are even needed, because this just scares people away from ordering pills and scares groups in other states away from sending pills. One concern that I saw raised is that the law criminalizes simply the shipping of the pills. Somebody doesn't even have to take them for a crime to have been committed. And so that's raising concerns that anti-abortion activists will do kind of sting operations, sort of entrapment-y things, where they order the pills solely in the interest of bringing a lawsuit, because there is like a cash bounty that you can get for filing a lawsuit. There's an incentive. So that's a concern. And then just the general concern of a chilling effect and people who are using less safe means than these pills to terminate their pregnancies out of fear, which, studies have shown is already on the rise, people injuring themselves, taking herbs and other substances, chemicals. So that's a concern as well.
We will continue to watch this, but back to vaccine policy. With the status of federal vaccine recommendations in limbo, states appear to be going their own way. Blue states, California, Washington, and Oregon are banding together in a consortium to make official recommendations in the absence of federal policy, and several blue state governors are acting unilaterally to make sure COVID vaccines, at least, remain available to most people. At the same time, some red states are going the other way, with Florida's Surgeon General Joseph Ladapo, who we have talked about before, before, now vowing to get rid of all vaccine requirements for school children. Sarah, that would be a really big deal, right?
Right. I think the big fear then is that the school requirements is kind of what gets us to close to, in many cases, universal vaccine uptake in the country, because everybody needs their kids to be in school. Unless you're homeschooled, you really must follow these vaccine requirements. And it not only hurts the kids who don't end up getting vaccinated individually, but it can really hurt the idea of herd immunity and the protection we need for these diseases to disappear in the community. So there's
and protection for people who can't be immunized,
right? Who either
reason.
Can't be immunized or don't have an adequate response to the immunization because they're going through cancer treatment or they have some other medical reason that their body is immunocompromised.
So, I mean, is this going to end up like abortion, where its availability absolutely depends on where you live?
I think that's hard to say. I think that a policy like what Florida is trying to implement could very quickly and easily go wrong, I think, and be reversed, as we've seen like what's happening in Texas now with measles outbreaks. You only need just very small fractions of decreases in vaccination to create huge public health crises in places. And so I think it would be more sort of visible in a way to some of these like states and their populations, the potential harm that could be caused, than maybe it is to them the abortion harm. But we definitely are seeing some sense of of the Democratic controlled states trying to implement policies that help people get better access to vaccines, even when the federal government is trying to maybe harm that, and red states not caring as much. So is going to be some more of a patchwork. And I feel like in talking to just sort of people outside of the health policy space, there is a lot of confusion about like, where can I get my COVID vaccine? Am I going to have to pay? Do I qualify? Especially being in DC, which has less generous, I guess, like pharmacy laws because of this, so people are confused. Like, if I go to Maryland, which is really close, or, does that matter, even though I live in DC? And it's just, all these things we kind of know end up leading to less people getting vaccinated, because even if they want to do it, the hurdles end up, driving people away.
Yeah, I think something you'd said earlier about the fact that we're seeing kind of a COVID spike, so people are anxious to get COVID vaccines, I think, a little bit earlier than normal. It's usually kind of a fall thing, and it's only the beginning of September. But I think there's just this combination, this confluence of events that has a lot of people like very excited about this right now.
Yeah, I think it does. And COVID has been, I think there's been lots of hope in the public health world that COVID would become a little bit like the flu, where we could predict a little bit more when it would really peak and get everybody vaccinated around the same time as they're getting flu vaccines, just again, because we know when we make it easier on people to get vaccinated, if you could just like one and done it, it would be good. Unfortunately, COVID has tended to also still have summer peaks. And this year, again, it's kind of a late summer peak. And a lot of people, including seniors, are still recommended really actually to get 2 vaccines a year. So many people are kind of coming due for that second update right now.
Well, we'll keep watching that space. Moving on, as we kind of pointed out already, Congress is back in town with just a couple weeks to go before the start of fiscal 2026 on October 1st. This was the year Congress was really, truly going to get all of its spending bills passed in time for the start of the new year. How's that going, Jessie?
It's going great. I'm just kidding. There's a lot of friction on the Hill right now. The White House budget chief is talking about doing more clawbacks of foreign aid, which is frustrating both Democrats and Republicans. It's about $5 billion, and we're seeing Democrats kind of start to put their neck out there a little more than they did earlier in the year, when they were also kind of making noise about government funding. And they're now saying that Republicans are going to have to go this alone, and they're not going to support partisan spending bills. So it's kind of difficult to see where we go from here. And
are we looking at a shutdown on October 1st? I mean, that's what happens if the spending bills aren't done.
It's hard to say. There might be a short-term spending bill, but anything like longer term than that, it seems really difficult at this point. And there are just like massive differences between the health bills that the House came out with and the Senate came out with. I mean, there's differences in all the other appropriations bills too, but I was just going to focus on health.
Yes, please.
The Senate bill would allow an increase for HHS, and the House bill would cut it pretty significantly. So it's kind of hard to see how they could do anything more substantive when there's so much light between the two.
Yeah, I mean, on the one hand, we have both the Senate and the House subcommittee that's marked up the labor HHS appropriation on record as not supporting at least the very deep cuts to the National Institutes of Health that were proposed by President Trump. But on the other hand, as you mentioned, we still have the administration, primarily Budget Office Chief Russell Vought, making the case that the administration doesn't have to spend money that Congress appropriates. And from all we can tell, at least as of now, there's a lot of money that won't be spent as of the end of the fiscal year, despite the fact that that is illegal. It's known as a pocket rescission, a term I think we're about to hear a lot more about. Alice, you referred to this earlier. Is Congress just going to quietly ignore the fact that the administration is usurping their power?
I think that in many areas of politics, there is a faction that wants to play hardball and really use whatever leverage is possible. And there's a faction that wants to play nice and try to get what they can get by negotiation. And I think both parties always fear being blamed for shutdowns. And so that drives a lot of it. But, I think there's mounting frustration with Democratic leadership about not playing hardball enough. I mean, the jokes I hear are, Democrats like to bring a spreadsheet to a gunfight. Just seen as being unwilling in the face of what many see as, lawlessness, being unwilling to really put a check on that using the levers they have, including, this federal spending. But I think we've seen that there are risks no matter what they do. And so I think, people make reasonable points about the pros and cons of various strategies.
Well, we know that Susan Collins, who's now the chair of the Senate Appropriations Committee, is very, very concerned, because Susan Collins is always very, very concerned. But she's the one whose power is basically being thwarted at this point. I mean, people have gotten a lot of gray hair waiting for Susan Collins to stand up and be combative. But one would think if there was ever a time for her to do it, this would be it. Jessie, are we seeing any indication that the appropriators are going to say, hey, this is our job and our constitutional responsibility, and you're supposed to do what we say when it comes to money?
They are saying these things. I feel like we are seeing more Senate Republicans at least express discomfort with what the Trump administration is doing, saying things like, this is Congress's job. We have the power of the purse. And then they are passing some of these spending bills through committee. But what else are they supposed to do? Unless Susan Collins wants to get on Fox News and start screaming about government funding, which I don't really see happening. And I don't know if it would be effective. You kind of just wonder, what other options do they have at this point?
Yeah, well, we'll sort of see how this plays out over the next few weeks. Meanwhile, it's not just the spending bills that Congress is facing deadlines for. This month is basically the last chance to re-up those, quote, expanded subsidies for Affordable Care Act plans before the sticker shock hits 24 million people in the face. Not only are premiums going up by an average of 18% from this year to next, that's for a lot of reasons, increasing costs of health care, tariffs, drug prices, but eliminating those additional subsidies or actually letting them expire will cause some people to have to pay double or triple what they pay now. And it's going to hit folks in red states like Georgia and Florida and Texas even harder, because more folks there are on the Affordable Care Act plans because those states didn't expand Medicaid. Do Republicans not understand what's about to happen to them?
I think they understand, but they keep acting like there's no urgency to the situation. They keep saying, we still have time, we have till the end of the year, which I guess is technically true, but we're already seeing insurers proposing these, giant rate hikes. And it's not easy to just, go back and make changes to some of this. I guess the idea is
they really don't have until the end of the year, though, because people are going to get their, they're going to see the next year's premiums and they have to start signing up in November. So, I mean, they basically have this month.
If there's uncertainty, they're going to price very conservatively, aka high. They don't want to be left holding the bag. And so, yeah, you and Jessie are exactly right that there isn't time. These decisions are being made now. Even if they pass something to kick the can until after the midterms, I think some damage will already have been done.
Yeah. Jessie, I cut you off, though. I mean, the idea is if sort of their one chance to maybe do this before people actually start to get these bills, or at least see what they're going to have to pay, would be wrapped into this end of fiscal year continuing resolution. And, maybe they can kick the appropriations down the road until November or December, but they can't really kick the question of the subsidies down the road until November or December.
Yeah, I think something would have to happen really quickly. We're seeing some politically vulnerable Republicans in the House specifically say that they want at least a year-long extension. It's just a really difficult issue. We know, obviously, the Freedom Caucus is already making threats about it. They hate the ACA. Maybe more than anything. It's going to be really interesting how this turns out. I've also heard that maybe there might be a pared back version of an extension that they could do, maybe messing with some of the income parameters. But I don't know if that kind of compromise would be enough unless Republicans work with Democrats, which, as we already said, is complicated for other reasons. So it's just a mess right now.
I love September on Capitol Hill. All right, finally this week, Medicare has announced it will launch a pilot program next January to test the use of artificial intelligence to perform prior authorization for Medicare fee-for-service patients in 6 states. The program is aimed at just a handful of services right now that are considered to be often wasteful and of dubious value to patients. So honestly, what could possibly go wrong here? This is a serious question. I mean, isn't using AI to do prior authorization what got a lot of these private health plans in trouble over the last year?
Yeah, I mean, they did. United Healthcare, I think, is sort of infamous for that. There's a lot of irony when they first announced this concept of doing a little more prior auth, essentially, in Medicare. It came right after they made another announcement where they were trying to say we're actually going to crack down on prior authorization for health plans. So there's a bit of and I think they were trying to not have in this second announcement, not have the words prior auth so that they could kind of get wins on both levels, because I think they know that prior authorization is generally not popular with health consumers. People see it as kind of a barrier to care that their doctor has said they need and is largely stopped because of cost reasons. And then I think once you add in this idea that artificial intelligence is doing it, not a human being, I think people have less trust that it's being done in the proper way and really that they're stopping inappropriate care.
Well, to paraphrase RFK Jr. at the Senate Finance hearing, who said many times, both things can be true, even if they are contradictory. All right, that is this week's news, or at least as much as we have time for. Now we'll play my Bill of the Month interview with Tony Leys, and then we'll come back and do our extra credits. I am pleased to welcome back to the podcast KFF Health News' Tony Leys, who reported and wrote the latest KFF Health News Bill of the Month. Tony, welcome back.
Glad to be here. Thanks, Julie.
So this month's patient got a literal mouthful when she went to photograph the night sky in Arizona. Who is she and what happened?
While Erica Kahn was taking photos at Glen Canyon last summer, a bat flew up, landed on her, and jammed itself between her camera and her face. Kahn screamed, as anyone would, and the bat went into her mouth. It only was in there for a few seconds, and she didn't feel a bite, but she feared it could have infected her with the rabies virus, which bats frequently carry.
Yeah, not a great thing. So as with any run-in with a bat, Erica wisely reported to the nearest emergency room for preventive rabies treatment, which we know from previous bills of the month can total many thousands of dollars. How much did her treatment cost?
Nearly $21,000, mostly for a series of vaccinations and other treatments over the course of 2 weeks, aimed at preventing the deadly virus from gaining a foothold.
Yikes.
Yikes, indeed.
Now, the problem here wasn't so much that she was charged as what her insurance status was. What was her health insurance status?
Well, Khan had been laid off from her job as a biomedical engineer in Massachusetts, and she had turned down the COBRA plan, which would have allowed her to stay on her employer's insurance plan. The plan would have cost her about $650 a month, which seemed too much for her, and she was a young, healthy adult who was confident that she would quickly find a new job with health insurance. She also thought that if she became ill in the meantime, she could buy a private plan that would cover pre-existing health conditions.
Yeah, that was the big problem, right?
Right.
So what did she do and then what happened?
So before she went to the hospital for rabies prevention treatment, she signed up for a policy she found online. The policy, which she thought was full-fledged health insurance, apparently wasn't. But she says the company selling it told her it would cover treatment of a life-threatening emergency, which this sure seemed to be. But the company later declined to cover any of the bills, citing a 30-day waiting period for coverage.
Yeah. Now, I mean, you can't generally buy any kind of insurance after an insurable event happens. You can't buy fire insurance the day after a fire or car insurance the day after an accident. Health insurance is no different. Although in her case, she could have actually resumed her previous coverage through COBRA, right? How would that have worked?
So after you lose coverage from an employer, you generally have 60 days to decide whether to sign up for COBRA coverage, which would be retroactive to the day your old policy lapsed. Khan was within that period when the bat went in her mouth, so she could have retroactively bought COBRA coverage, but she didn't know about that option.
Yeah, a lot of people, they initially lose their job or they leave their job and they don't take COBRA because it's really expensive as a rule because it's employer insurance and employer insurance is usually pretty generous and they think they don't need it. But this is one of those cases where she actually probably could have gotten it covered, right?
Right. And in fairness, I'd never heard about that 60-day thing either, and I've covered this, so.
I had, but I was there when COBRA was started. So what's the takeaway here about people who don't have insurance or think they can buy it at the last minute?
Well, two things. One is you should have health insurance,
Because you never know when a bat's going to fly in your mouth.
and that a bat in the mouth does not count as a pre-existing condition.
True.
We know that now.
And what happened with this bill?
She is still trying to get it worked out.
And presumably she's going to be paying it off for some time to come.
That's what it sounds like, yep.
But she won't get rabies.
No.
So, happy ending of a sort. Tony Leys, thank you so much.
Thank you for having me. Appreciate it.
Okay, we're back, and now it's time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We will put the links in our show notes on your phone or other mobile device. Sarah, you were the first to come up with your extra credit this week. Why don't you tell us about it?
I picked a piece that ran in NPR from KFS. Blake Farmer, leniency on licensed schools meets reality, because it's about the 1-year anniversary of my family getting lice from school. And I actually was exposed to this new reality, which is since I was in school, and it's, I guess, a broader national policy that they no longer kick kids out of school once you see lice and make it kind of difficult before you can go back to school. And I guess the public health rationale is generally that lice is actually, while it's quite itchy and it's not really harmful. So trying to think about the best way to cause the least harm, letting kids stay in school while you treat the infection is seen as most appropriate now. But there's been, as the story kind of goes into, some pushback from parents who feel that then it's just getting them in these cycles where they're constantly kind of getting lice and having to deal with it, and dealing with getting the shampoos and stuff for lice can be kind of costly. So I thought it was a slightly lighter healthcare story for people to think about in these times.
Yeah, risks and benefits. Classic case of risks and benefits. Alice.
Well, this is definitely more on the risks than the benefits side of things, but I have a very good piece from Vox. It's an exclusive. It's called RFK Jr. and the White House Buried a Major Study on Alcohol and Cancer. And so they talked to these scientists who were commissioned to compile all of the data about the risk of drinking alcohol to having cancer. And it was compiling high quality data that was already out there. And it really shows that no amount of drinking is totally safe. Even a very small, moderate amount of drinking includes a cancer risk, and that goes up the more you drink. And now, according to this report, the administration is not going to publish this. The authors turned it in March, and they've just been sitting on it, and they said they have no plans to publish it. And, this is coming as the alcohol industry does a lot of lobbying to try to prevent stuff like this from being put out in the public consciousness. I just found this really fascinating. Like, already the younger generations are drinking a lot less. And so there does seem to be a growing awareness of the health risks of even moderate drinking. But I think that anything that keeps people from seeing this information is worrying. Although this report did say that they are planning on publishing it in a, peer-reviewed medical journal, which they were always planning anyways, but not having the federal government's backing is a big deal.
It's not exactly radical transparency, just what they've been talking about. Jessie.
And it's not exactly MAHA. They're talking MAHA, they're talking about lifestyle stuff, they're talking about what you eat, but apparently not about what you drink.
Jessie.
My story is from KFF Health News from Bram Sable-Smith. It's called When Hospitals and Insurers Fight, Patients Get Caught in the Middle. It is about what happens when providers and insurers have contract disputes. The one example in this story is in Missouri, and it kind of focuses on this family that's caught in the middle of a dispute between the University of Missouri healthcare system and Anthem. And it means patients don't get care. There's not a lot of protections for them. There are provisions that were in the No Surprises Act, kind of intended to ensure there was some continuity of care in the situations. But at least for this couple, they weren't really able to access those protections. So unclear if those are working as intended. I just thought it was really interesting because it's not a new problem, but it's definitely something that we're hearing more and more. It just happened in the DC area a few weeks ago. It just happened in New York, and it kind of raises questions about what are policymakers going to do about this. They complain about rising healthcare costs, but they don't often do very much. They complain about competition and consolidation, and this is one of the effects of that. People lose access to care. So I thought this was a really interesting story.
Yeah, these are all the policy issues that policymakers are not working on, but could be. My extra credit this week is from ProPublica. It's called Gutted, How Deeply Trump Has Cut Federal Health Agencies by Brandon Roberts, Annie Waldman, Pratik Ribala, and Sam Green. And it's a deep data dive that found that more than 20,500 workers, or about 18% of the Health and Human Services Department workforce, have left or been pushed out in the first month of Trump 2.0. That includes more than 1,000 regulators and safety inspectors and 3,000 scientists and public health specialists. The agency, in its official response to the story, said, quote, "Yes, we've made cuts to bloated bureaucracies that were long overdue for accountability. I guess we will have to see if America gets healthier. In the meantime, it's good to have some data on where we were and now where we are at HHS." Okay, that's this week's show. Thanks to our fill-in editor this week, Stephanie Stapleton, and our producer-engineer, Francis Ying. If you enjoyed the podcast, you can subscribe wherever you get your podcasts. We'd appreciate it if you left us a review. That helps other people find us, too. As always, you can email us your comments or questions or at whatthehealth, all one word, at kff.org, or you can find me on X at jrovner or on Blue Sky at Julie Rovner. Where are you guys hanging out these days? Sarah?
Kind of everywhere. On Blue Sky, X, LinkedIn, Sarah Karlin or Sarah Karlin-Smith.
Alice?
Mostly on Blue Sky at Alice Miranda, and still on X at Alice Ollstein.
Jessie?
I am on X at Jessie Hellmann. I'm also on LinkedIn.
We will be back in your feed next week. Until then, be healthy.